Hello and welcome to this special issue of PD on a Pocket. I wish we didn't have to do this one because it's about COVID-19 again, but here we are. And I'm really pleased to have someone from the Ministry of Health with us today. Jan Fizzell is the Senior Medical Advisor from the Ministry of Health. Welcome, Jan.
Good morning, Lisa.
So look, can you tell us, basically, what's the best way for educators to keep themselves safe at the moment, especially those educators that work in the lockdown areas? You know, we've got quite a few in Greater Sydney and, of course, quite a few in the Liverpool, Canterbury, Fairfield area.
Look, the first thing that we can do is just be really aware of our environment and who's in it and how they're in it. So the first thing is being aware of, are there any warnings for my particular area? So have people been asked to stay at home or have extra testing? And are there any hot places that I go where I could potentially interact with other people? So I know for many people, work is the major place where we interact with other people. And if you're an early childhood educator, the chances of working from home or having your work come to you at home is really important because
remember, we're dealing with family daycare educators. They get to work from home the whole time.
Absolutely. So your work comes to you at home.
Yeah.
And so I think that's the really important thing is having a really good rapport with the carers and parents of the kids who you're looking after, working with them each day to build that trust, to make sure that they know that your expectations are that they'll keep their kids at home and not bring them to you if they're unwell. That if they've been asked to isolate and their family's been asked to isolate, that they will let you know and make sure that they don't bring their children if they've been asked to isolate. So isolate is what happens when people who have been exposed to the virus are found by contact tracers, and we say to you, you're at higher risk of having the virus. Please, you must not leave your home and you must get tested and you must stay home for 14 days. So we ask some people to isolate, and that's different to the stay-at-home orders, because if you're in a stay-at-home area, basically people are still allowed to leave home for essential work, or you're allowed to provide childcare in your home. So it's really important that people have that opportunity to think really carefully about bringing their kids to your place. I think the other thing is just while you're out and about in the community, really limiting your time out and about as far as possible. When people are dropping off the kids, I guess it will depend very much, but try really hard. I know it's hard to not have a really good conversation with parents, especially if you're in the intimate setting of family daycare, but try and do that conversation about their child's day, what they've done, all those sorts of things, perhaps through a phone call at the end of the day, or however you'd normally spend that chunk of time with the pick up or drop off. Try and do it as far distant as possible. So maybe bring the child into the home and then have a chat with the parent on the phone, and parents in the driveway, and you're in your house.
Okay, that makes sense. What about vaccine hesitancy? I think there's a fair bit of it in family daycare. What can you tell us to make family daycare educators feel comfortable and, in fact, even eager to go out and get vaccinated? I know I was eager. I can't wait to get my second one.
Look, I think one of the key things is people are been saying they're concerned that we've got these vaccines so quickly, and we haven't got these vaccines so quickly. The vaccines have come on years and years and years of research, which has then been channeled through a major international effort into having safe and appropriate vaccines against COVID-19. The other thing that we're doing is we're actually immunizing millions of people with the same vaccines around the world all at once. So some of the information that may have taken us 5 or 10 years to collect about rare side effects, we're finding it out really, really fast. And perhaps in our complete and utter desire to be open and transparent about everything to do with the vaccine, some of the risks may have been overemphasized compared to the huge benefits. So the first thing is to say that both vaccines help prevent you becoming sick. They help prevent you going into hospital. They're very good at preventing you going into intensive care in hospital, remembering that we've had in this current outbreak even people under the age of 20 with no significant medical conditions in intensive care. You know, they've been that close to dying because of the severe nature of this illness. We've had people who have unfortunately passed away. And it's, again, this is a very severe illness in any age group. And so it's really important, no matter your age, to get vaccinated. The older you are, the higher the risk is that you will wind up in intensive care or hospital, or that you may have some lifelong problems after having COVID-19. It's not a mild illness for many people. For some people, it will only be just like a bit of a cold. You'll have a bit of a runny nose, a bit of a headache, and feel off. But while you're having that bit of a headache and a runny nose, you can infect your entire family. You can infect any of the work colleagues you go to, and you can also infect the kids you're looking after. So it's really, really important to not ignore any of the symptoms and to get tested. The really important thing about the vaccines, though, are they are free, they're available, and many, many early childhood educators are currently eligible to be vaccinated. The key things are, if you are over 40, no matter what your circumstances, you're eligible to be vaccinated, and you can book in at a GP or at one of the New South Wales vaccination hubs or one of the Commonwealth vaccination hubs. If you're under 40, if you're providing care on a regular basis to somebody with a disability, if you have an older person that you provide care for on a regular basis, if any of the children that you care for have significant disabilities or significant medical conditions, or if you yourself have other medical conditions or a significant disability, you're currently eligible to be vaccinated with either vaccine. If you're under 40 and you haven't got any of those special considerations, the AstraZeneca vaccine is available to you. The key thing is to have a chat to your GP about the risks and benefits to you personally, and then your GP will be able to advise whether you should be vaccinated with that vaccine or not. It's a good vaccine. If it was the only vaccine we had available, we would all be rolling up our sleeves and thanking the heavens for that particular vaccine. And so it's really important for people to not think that it's a second-class vaccine. It is a great vaccine. It provides really good protection after you, particularly after you get that second dose. And so it's worth considering if you find that in your local area it's hard to access the Pfizer, or if you're not currently eligible for the choice if you're under 40.
But blood clots.
Oh, I know. And look, I think we should put this risk into the wide range of risks of us as humans and what we're willing to do. Most of us are happy to fly to Europe if possible. I think that's true. If you go on a long haul flight, you have a 1 in 6,000 risk of developing a clot in your leg that can travel to your lungs and cause major, major problems, including death. If, however, you have the AstraZeneca vaccine, even if you're quite young, you've got about a 1 in 100,000 risk of getting a very severe blood clot. So, we're talking about significant differences in risk here. And most of us, when I'm traveling long haul, getting a blood clot in my leg is not the thing closest to my mind.
I don't even wear those support hose. I'm going to wear them immediately. I had no idea it was so high.
It is so high. But again, it's one of those things that because it's not immediate, it's not a choice we're making, am I going to get a blood clot or not? We feel like we've got control of that particular thing. With the AstraZeneca vaccine, what people don't realize is that means that out of that 100,000 people, 99,999 have no problems whatsoever. But if we look at COVID causes clots too. And so particularly once you are over 30, your risks of getting a clot from COVID when you're in a high prevalence area is much, much higher, and really nasty clots too with COVID. COVID is not nice. It's a really nasty disease. Then you've got a much greater chance of actually getting a clot from COVID than you actually have from getting it from the AstraZeneca vaccine. Plus, COVID can do all sorts of other nasty things to you, and the AstraZeneca vaccine can prevent those nasty things from happening. So I'd put my money on the AstraZeneca, to be perfectly honest.
Yeah, I know that some of our educators come from countries that are really struggling to get any vaccines. And I'm sure if we turned to them and said, oh no, I think I'll wait for the Pfizer because the AstraZeneca isn't quite so good, they'd be really horrified because, if it's a choice of life or death, which it is for much of the world, you get what vaccine is available to you.
And I think that's it. Members of my family have had both vaccines, and people in my family are now protected. So even though this is a really difficult and worrying time for so many of us, I do have some peace of mind that our risks of taking up an ICU bed, or my risk of attending their funeral, to be perfectly frank, is much, much less. So I think that's why.
But we are hearing about some people that have been vaccinated being in ICU or being hospitalised. What's that about?
So when we say that people who are fully vaccinated are at reduced risk, it does mean that if I've vaccinated 1,000 people, I think it is, one of those people may still be susceptible to going into ICU. So enough people who are fully vaccinated, we may get some people who do wind up in ICU, but the people who are in ICU, or they're often partially vaccinated. So they've had that first dose and then they haven't sealed the deal with the second dose. Sealing the deal with the second dose is super important. And we've actually suggested with the AstraZeneca in New South Wales at the moment, if you've had the first dose, bring forward that second dose by a month so that you get that second dose into you that much faster. You'll still have really good protection, perhaps not as fantastic super duper as at 12 weeks, but you'll get some good protection from that vaccine. It's also really important that people understand that vaccines limit the severity of the illness. So I'll give you an example of my son. He was born at a time when chickenpox vaccine wasn't widely available. I did get him vaccinated against chickenpox. They had an epidemic of chickenpox in his year 1 class. He had one spot and a bit of a runny nose, whereas there are other kids with that whole miserable illness of mouths full of sores and arms and legs full of sores. So whilst he did have a breakthrough illness, for him it was a minor inconvenience, whereas for other children it was a lot of suffering. So we may see the same sort of thing with COVID, where you may get a minor illness, but that minor illness is nowhere near as severe as winding up in hospital or ICU.
Yeah, that's true. Okay, so let's move away from vaccination to ventilation.
Yep.
How important is ventilation as a way of stopping COVID?
As I sit in my obviously closed up lounge room by myself, it is really a really important thing. COVID likes being indoors. It likes us when we're close together. The new Delta strain is a bit more ferocious, and so it will transfer even between people wearing masks. But when you wear that mask, it means that if you're infectious, the chances that you're spitting virus out into the world are greatly reduced. And if you're wearing a mask, the chances that you will receive that spit virus is much, much less. But outdoors, it means that there's much, much more room for that spit out virus to go around. So the chances of infecting somebody else outdoors greatly decreases. So where you can, and I agree, Sydney is very cold today, and it may be cold wherever you are, it might be beautiful weather, but where you can do things outdoors, outdoors is the place to be.
Okay. When should educators have a COVID test? I've been lucky enough not to need one because I've never had any symptoms. One night I was a bit, maybe I'll think about it, and by morning I was fine. So I've never had to have one. But when should educators make that decision that, yes, they should go and have a COVID test?
So the first time you should have it is if you have any of those symptoms. So this is not a sore or scratchy throat. This is me talking too much today. But if you had a sore or scratchy throat, a runny nose, feeling hot, cold, bit of a headache, just feeling generally run down and out of sorts. I know many of it, for us, that's, nearly every day at the end of the day, but abnormally so. That's a good time to get a COVID test because the symptoms of COVID can be very, very mild to start with. The next time you should have a COVID test is if New South Wales Health asks you to. So sometimes you will have been to a certain venue where somebody with COVID has been, or you will be in a house where somebody in your household's brought it home. We'll ask you to get tested on a regular basis. The contact tracers will tell you how often, and you should get a test in those circumstances. The other time at the moment is when we have a local government area where there's a lot of infection going on and you have to leave your local government area to go and work. Those people are being asked to test on a regular basis. At the moment, it's 3 days for people in certain local government areas.
That's not educators because they're all working from
at home, of course. But somebody from their family may need to leave.
Yep.
Yeah. And so if somebody from their family needs to leave, it's important their family members, their household members keeping up with that surveillance testing. So the early childhood educators working from home, not a problem. But if they've got a family member who's leaving, it's really important that they continue to encourage that family member or household member to do that.
Okay, and masks. I think every educator was a bit shocked that the department's now decided that educators need to wear masks. Why should they wear masks when they're working with children, apart from the fact that it's now the law?
Look, the thing that we've learned about Delta is previously kids were really bad at giving COVID to other people. They, unlike flu and gastro and all the other bugs that kids, share with us so generously, the COVID was not one of those ones that kids shared generously. Delta strain has changed that for us, unfortunately, and we now are seeing child-to-child transmission and child-to-adult transmission. Previously, in most sectors, we were mostly worried about adult-to-adult transmission. Now, with the kids, we're seeing child-to-child and adult-to-child and child-to-adult transmission. So wearing a mask will help if you're infected from infecting the kids, and may give you some protection from the kids if they're going to infect you. So even if you're in your own house, and I know how easy it is to wind up with a chin diaper or an earring, try and keep it on. Try and get the kids used to you wearing it, because I know for some kids, but a lot of kids are really used to it now. I saw a couple of kids and now they're starting to point out, that one's not wearing a mask, Mum. And so it's becoming a bit of a social norm for adults to be wearing masks in so many situations now. This will just be another situation where the adults are wearing masks.
You talked about the Delta strain. We've learned, people have learned a little bit about it in the webinar that we've just held, but how much more infectious is the Delta strain than previous strains of COVID?
So what we're seeing in international experience is a person with Delta strain can manufacture about 1,000 times more viral particles than a person infected with our old-fashioned COVID, if you like. And so that means that you've increased the ability to give the Delta strain to other people by about 50%. So previously, people used to infect about 2 people. Now we're seeing them infect 4 to 5 people. But the other thing that they're doing is they're doing it really fast. So time from exposure to being able to infect someone else used to generally be about 72 hours and more generally 5 days. So you used to have quite a bit of time between being exposed and actually infecting other people. What we're seeing now, though, is somebody is exposed, becomes infected, starts making their own little virus factory, makes the particles, and they're able to infect somebody else within 24 to 48 hours. So it moves really, really fast. That's the other thing. And that's a lot to do with how much virus we make. Delta seems to be very good at teaching our body to make more virus, because that's how viruses work. They use our bodies to make more viruses to spread more viruses. And Delta is really good, one, at infecting you. 2, because it makes so many viruses, it means that the next person's more likely to be infected, and that more likely to be infected next person makes viruses even more quickly. So it spreads really, really fast. And that's where the mask helps, because it means that despite Delta's desire to get out of you and spread everywhere, that mask helps catch most of it. It doesn't catch all of it, but it will help catch most of it and reduce the risk of infecting someone else. And similarly, wearing that mask means that if you're walking past a human virus factory, you've got less chance of breathing in their virus.
It doesn't sound like something I want to ever come in contact with. Could you just answer one other question, which I know people are sometimes puzzled about? Masks. Are there better sorts of masks than other masks? How often do we need to change our mask? What's masking protocol? And which way does the colour go on those disposable ones?
Sure. So the best mask is the one that you're wearing. So if you have no mask and there is a mask, any mask is better than none. That's the first thing to say. The surgical masks or the medical masks that have got the color on the outside and a white on the inside, they've got a fluid repellent layer. And I also find that they're quite good for me because I'm wearing glasses and I can actually mold them around my nose so that I'm not getting the constant condensation up behind my glasses all the time. So I tend to use the disposable surgical masks. They've often also got really nice soft elastic, which doesn't cut into my ears quite as much. If you want to use a reusable mask though, try and get one that's got 3 layers of fabric, with the outer being a bit of a fluid repellent material. That could be an old tent, that could be one of those green shopping bags, although I will tell you those green shopping bags are very hard to sew through, with a couple of cotton layers on the inside like t-shirt material just to absorb things. And generally speaking, with the mask use, they usually will last with you talking and being active for about 4 hours before you need to change them. But do try, and I'm not always good, but do try and remember to do your hand hygiene before you handle your mask and after you've handled your mask. And that simply just stops you, if you are happening to be that virus factory, from, putting virus down around you and where you're doing things with your mask. But not always possible. And certainly more difficult when you've got to talk to people or yell to people or do anything else where your voice isn't clear. So it is hard, but also at the same time, I remember having to stand for 5 hours in an operating theatre with my elbows deep in somebody's guts for 5 hours with a mask on straight. So talking with a mask on doesn't seem that hard compared.
Definitely not. Okay, is there anything else you want to say to educators? Thank you for all your advice.
Look, early childhood educators are an absolute cornerstone in people's development, and you are so important. And so you also have a lot of power to educate and to spread good messages to people. So please keep doing what you've been doing for many, many years. Help the kids understand what's going on, help them if they're frightened, reassure them that, yes, this is different, but we will get through this. Talk to them about why you're wearing a mask. You've got the same words as I've just given you. You can use those words too. It really is just about catching spit and stopping breathing in somebody else's spit. And do please, just as you would like the kids who are coming to you to be immunised against nasty diseases like rubella and measles and so on, please take the opportunity when it's offered to you to get vaccinated. I know it's not easy at the moment, but please keep trying. Those vaccines are out there and more are coming. So please roll up your sleeve, protect yourself, protect your family, and protect the people you're caring for. It'd be really, but just stay safe, keep doing a great job, and thanks for listening to me.
Thank you very much, Jane.